Hello and welcome. Today I am joined by Dr. Dan Brooke, who is consultant in sport, exercise and musculoskeletal medicine. So Dan, thank you for joining and giving us your time today.
Thanks for inviting me.
No problem. Whereabouts are you today then?
So today I'm at my clinic at Pure Sports Medicine, and that's in the City of London. And today I'm at the Chancery Lane Clinic, which is Chancery Lane near Holborn, in this edge of the city.
Very good. Yeah, I've been to one of the clinics there, but there's quite a few, aren't there, for Pure?
I think there are 7 now, so they're mostly in the city. I think there's 4 or 5 in the city. And there's one in Kensington, one in Canary Wharf, and then one in Rains Park, which is near Wimbledon. So they've got a bit of a footprint in London.
Right, because I remember when I when I was employed, so I was working for another company 15 years or so ago, I met Mike Bundy, who was involved. So is he still involved in this then?
No, Mike retired a few years ago, so he was, I think, mostly at the Kensington branch, and I think he retired a few years ago. But I knew Mike then, and he saw my wife as a patient, so trustworthy and an excellent sports doctor.
Very good. So yeah, get back onto you then. So whereabouts are you from originally?
So I born and brought up in Cheltenham in Gloucestershire. Went to school there, and my parents still live there, although they've moved house recently to a slightly smaller one.
It's a nice place, isn't it, Cheltenham?
Yeah, and the more I've sort of grown up and had children myself, I've realised that sometimes the quieter places with more green spaces are a bit nicer. And yeah, I do. I think when I was at school, it was good, and then as I became a teenager, early 20s, it was not as exciting. But I enjoy going back now, and it's a nice place and lots of green spaces, which makes a big difference.
Yeah, no, I'm sure. So then when you were growing up then, so was it the aspiration to move to the big city to study and work?
I not necessarily. No, obviously went to London sometimes, but Cheltenham's a reasonable sized town. But I wouldn't say I necessarily had a desire to be in London, or certainly not in the city, and it just kind of fell into place really. But then you go where a lot of the work is and the demands, so it's something I'm enjoying. Might not be in the city forever with the commute and coming in and out, but it's pretty now. There's people, normal amounts of people. I think they said about 90% of previous traffic flow and foot flow. It's quite an enjoyable place to be.
Yeah, no, it's always got a great buzz. I still love going down there. So
Yeah.
when you were starting to move into this profession then, like what was your motivation for that?
I love sport. My TV is normally on Sky Sports News or one of the sports channels, and I've always loved watching sport and taking part as a very average amateur. When I realised I wasn't going to make it as a professional athlete, I tried to think of other ways I could get involved in sport, and I've always just found it really exciting, inspiring, and then as I was going through medical school, found orthopedics, musculoskeletal, and sporting injuries as one of my interests, and I was introduced to the specialty by Dr. Rod Jakes, who's recently retired as the Director of Medical Services at the English Institute of Sport. I did an intercalated BSc, so an extra year between my 3rd and 4th year, and that was at Mile End Hospital, which is part of Barts in the London. And I just loved it. I found the actual medicine really interesting. It's really inspiring, and managed to work my way through and eventually became a consultant.
Right. And was there a particular sport that you liked when you were growing up then?
I'd probably say football was what I spent the most amount of time and energy on, and maybe do now. As an Arsenal fan, I have not spent as much time and energy as I did in the glory days, but that probably speaks to me as much as anything. But and probably just getting a bit older and having a child and not, trying to get down to the Emirates every weekend for the game. I've spent less time, but football, and I keep up to date with everything. I also really like rugby and have ended up working more in rugby than any other sport. Hockey, I played at school and I played at university and was captain of the university team, which was good fun, and cricket as well. I'd happily have the cricket on all day watching a test match. That would be the ideal.
Yeah, so quite a diverse range of sports.
Yeah, most things. I'd watch a bit of golf, but not as much. But tennis, yeah. Most things, really.
And when you're watching sport, then are you always looking at it from a professional standpoint as well? Maybe not Arsenal, because it's a bit more passion there, but
certainly rugby, because I've been doing the head injury assessments for a while, through Premiership and European rugby, and also some international work, but also done a lot of pitch sides work covering matches. And I definitely watch a rugby match differently now than I used to, because even when I'm watching as a fan, I think it's almost like a muscle memory thing. You're watching the ruck just to see how people get up. If there's a big impact, you're not following the ball. You're seeing, has so and so got up? Are they okay? I still watch and enjoy it as a fan, but I think part of me now, having watched so many games as a doctor and as a clinician, watching how people are, it's slightly changed the way that I view it. I think working in sport as well, it gives you more of the reality of it. So you appreciate what people do, how they train, how they work hard to get there, but also you understand the warts and all approach as well. So it just changes your perspective slightly.
Is that a negative context, as in, like, can you fully enjoy watching any of those sports, or say rugby in this instance, or does it actually spoil it?
No, I definitely don't watch rugby the same, because I was doing a game on Sunday and Tuesday as covering the match day doctor role. So you have to concentrate so hard. We're lucky we have the Hawkeye cameras, and we have the tablet to look at the different angles and go back and things, but just still watch it a bit differently. And also, if there's a big impact, you sort of thinking, is this going to be an injury? Or if someone falls down in a nasty looking way, you think, could that be this? And then part of you is your clinicians go, I wonder if that's an Achilles injury, or has done his MCL in his knee. But I can still enjoy it. I'm not a complete medical nose for watching things. I still realise that there's more to life than being a clinician all the time.
Yeah, well, that's definitely gives a bit of balance. So when you'd qualified, Ben, what was your roles? How did you progress into this area?
So I graduated from medical school in 2010. So did 6 years then, and I knew after my intercalated BSc, so between my third and fourth year, that this was what I wanted to do. So I tried to do things throughout my career that would help me gain the skills and experience that were relevant to the career. So you do essentially start quite broad with your training as a doctor. Your F1, F2 years are quite broad, a mix of very general things, general medicine, surgery, GP, A&E, etc. And then as you go through, you become more focused. So I then did my GP training, because I felt that the skills and experiences as training as a GP would set me up best for applying for sport and exercise medicine. And also, if you want to be a team doctor, you're essentially their GP anyway. So that felt to be the most relevant thing. So I did my GP training in Surrey at Frimley Park Hospital. I then luckily got straight into sport and exercise medicine training in London, and then obviously did my 4 years as a registrar and then qualified in the middle of a pandemic, which was not planned, but we adapt and thrive, hopefully.
So in terms of doing the qualification in sport and exercise medicine then, so like how competitive is it to get into that area of actually becoming a consultant?
So to actually do the specialist training and get into SEM, there aren't huge numbers that apply, but I think those that do are generally really well qualified and have pretty strong CVs and pretty strong applications. And I think this year, I think there are only 5 or 6 training numbers nationally. Sometimes if people have been on maternity leave or if they've taken time out for research or other things and they don't have the spaces, and there can almost be a bottleneck. And I know this year I think was particularly competitive. When I applied, there were 3 training posts in London, and I was lucky enough to get one of them. There are also some in Birmingham, Oxford, Sheffield, Manchester, Liverpool areas. Yeah, so there's a few. It's not huge numbers, and huge numbers don't apply, but I think those that do are generally pretty well qualified and have got some really strong applications.
So is that why it is so competitive then? Because you've got a number of people. Like, what is the process for you to actually say, I want to do this, I want to do it? Do you pick where you go, or do you just apply for, like you would do for any role?
So you have to have done you do your F1 and F2, your foundation years. So F1 Doctor, F2. You then do essentially what's called core training, and that can be in things like A&E, general practice, general medicine, surgery, pediatrics, psychiatry, obs and gynae, things like that. So you start quite broad, and then you become more narrow and focused. To get into sport and exercise medicine, there are 3 entry routes. One is through A&E, so you do your 3 years core A&E training, pass all your membership exams. GP is your 3 years, and then because GP, you become a qualified GP after 3 years, or through general medical training, core medical training, which is 3 years, and again pass your membership exams. So there's 3 possible entry routes. You then have a national application for the role, which all medical specialties go through. So it's a very structured process, and you apply through a portal. You then have your application scored against a scoring system, and there are things like if you've had publications, presentation, quality improvement projects, audits, various experience is then scored, and if you then get through to the next stage, that's an interview, and that's a structured interview based on various things. You then get scored from that, and if you're lucky enough to get enough points, you get in.
Quite complex thing then.
It is. I mean, all medical specialties are like that. So even obviously to get into medical school, you have to have interview and application, and then just at each stage, and it becomes more relevant. So your general medical training is all quite generic, but then the more you progress, obviously, the more you're going to do well if you've got sport and exercise medicine specialist experience or all relevant experience.
So you've been involved with a number of different sports, as you mentioned before. Like what was your first route into working at it from a professional standpoint?
So I was always told to take your time, don't jump into it, because I think unfortunately there are a few people who do too much too soon when they don't have the relevant experience, and it's almost they're unconsciously incompetent. See, they don't know what they don't know. And the more I've progressed, the more I realise that, and I think that's very true as well. And so I was always told, find your local football, rugby clubs, find the doctor or physio who's there, and get some experience with them. Just shadow them, find out what it involves. Take your time, essentially. As a medical professional as well, you have to be careful not to work outside of your scope of practice. So if you're a medical student, you can't really do anything apart from shadow with somebody directly supervising. And even as a junior doctor, you have to look at what your approved, certified and examined skills are and competencies, and not to go outside of that. So I was lucky enough to shadow the doctor at Cheltenham Town Football Club, which is my local football club, which was brilliant. And I think sat in with clinics with Rod Jakes at his private clinic. I was lucky to do an elective in Stellenbosch in medical school in near Cape Town, and then I did one in Melbourne in Australia. So I managed to do that, which again was a brilliant experience, and going to other countries as well. My medical elective in Australia was 12 years ago now, which I can't believe. And Melbourne was just the most amazing place. I was really lucky. And then just as I've gone through, get some more experience, initially shadowing and then maybe working with other clinicians as I gain more appropriate skills. And then one thing led to another, and I ended up getting a few roles here and there and doing a few more sports.
And so for picking those roles in South Africa and in Australia, is that based upon the opportunity, or is it that you want to travel for a bit, or combination?
So when I left school, I did a gap year in Cape Town. So I worked at a school in Cape Town, which had a link with my school in Cheltenham. And so I had links and I had a fondness for the country as well. I luckily got a contact through someone at St George's Medical School who worked there, and got in touch with them and sorted it all out. And obviously, yeah, had the chance to visit another country, and I'd been there before. I hadn't been to all the vineyards in Stellenbosch, so that was worth exploring. And then with Australia, I'd never been, and so I had a link through the Sport and Exercise Medicine BSc at Mile End through Claire Small, who is now my boss at Pure. So I've known her since I was a medical student. And it was, my wife, then girlfriend, did 10 days as a tourist in Sydney, and then I went to Melbourne and she went back to work.
Nice. Yeah, Melbourne's an incredible, there's no better city really, is there, for sport than Melbourne?
It's amazing. Great people, great vibe, cafe culture, wine, good wine, nice people, but they love sport and physical activity as well, and it's all geared up to that. And yeah, I'd love to go back. And at one point I thought about even working there for a bit, but you just get tied into family life and things, and then start school, and you don't necessarily have the opportunities. But maybe at some point go for a bit.
Yeah, the exchange rate's a lot worse now, isn't it? It used to be much better.
Oh, I don't know. It's been 12 years, so yeah.
I was there 20 years ago, so yeah, yours isn't too bad.
Yeah, I remember Sydney was expensive, a bit more expensive than Melbourne.
Yeah.
But it was,
Yeah, a great place to be. So after Cheltenham then, so how long were you at Cheltenham for, and then what was the next role in sports?
well, I mean, that was really just in holidays and things. If I was back, I would send a text and say, "Oh, are you at the game? Do you mind if I pop along?" Then I think I shadowed Mike Rossiter, who was the England hockey doctor for a while. Shadowed him a bit, and then I actually did some. I'm trying to think, probably some Tough Mudder events, which is quite good because it's quite applicable to pitchside cover because of the types of injuries and things that can happen. And then I did a little bit of rugby volunteering, I think with Berkshire Rugby maybe. And then I got offered to help out at Ealing Trailfinders Rugby Club for their doing some matches, and then got offered the role as their club doctor, which I did for 5.5 years until Christmas. So, and then once you get your qualification for pitchside care in rugby, they'll often ask for help and support covering events. And I started doing a few festivals, a few camps, and then you kind of get a bit more experience. You're on the mailing list, and you get to help out a bit.
And so how much for some of these roles that you're saying you were doing it in holidays and just it seemed quite ad hoc, how much of this is voluntary, and that how much of a challenge is it on your time? I presume you're doing a number of other things as well.
Yeah, so especially when I was doing my general medical training, not the sports medicine training, a lot of weekends, a lot of annual leave and things, same as going to conferences as well. You kind of have to put the time in. So I think I volunteered at 5 London marathons as well, because that was a really great thing to be involved with. That was one of the first things, actually, I think, with Sanjay Sharma, who's the sort of don of sports cardiology. And that was a really good experience. Then did a bit of triathlon cover as well. And it's all voluntary, really. And it's nice, because it's a nice thing to be a part of. And it's kind of earning your corn, earning your spurs a bit as well. And it's nice. It's a nice thing to do to help out. But quite a bit of time. But I saw it as an investment in my CV, obviously, but also in my experience and skill development.
And in terms of like your CV, then is that something that you're actively thinking about, and is that something that many of your peers do as well? Like, you maybe think, right, do we need to try different sports? Do we need to do different roles?
I think, for any medical specialty, if it's competitive, then you've got to think, what do I need to do to score points on the application from a sort of cynical, practical perspective? But then also, what skills do I need to develop to become the best sports clinician or cardiologist or pediatrician or GP psychiatrist? And so you kind of try and get a wide variety of experience in different settings. Same with my elective. I thought, well, if I can do a sports medicine elective, that's good. Try and get some research as well and presentations, and you do have to think, especially for the more competitive areas. You have to think about that from quite an early stage, I think.
And then do you think as well, in terms of, say, working in different sports, like I noticed the Fulham shirt in the background, what was that?
That's not mine, no, that's been in the clinic for a while.
Oh, right.
When you get into the sports medicine training in London, there are opportunities to get some experience with sport teams. So I worked at Brentford for a year and a half, which was great, initially as part of my training, and then more independently. And these opportunities just come up, and if sometimes you're just in the right place at the right time. Or if you do a little bit, and then your foot's in the door, and you can develop it further, so long as you're a decent person and you're good to work with. It makes it more amenable, I think.
And then you do some work, like you in various clinics at Pure there. So in terms of that, are you always looking for a diverse portfolio of roles that you want to do as well?
So one of the biggest challenges becoming a consultant, not just it being in the middle of a pandemic and things being shut down on and off for a while, or people not venturing out as much, has been balancing the portfolio and getting the best work-life balance, where it remunerates me sufficiently, but also that I get enjoyment and fulfillment and can balance things together. So at one stage I had sort of 4-5 main jobs, which were some more regular, some more intermittent, but now I've really narrowed it down to 2 or 3, and just trying to set that balance of having some variety and some interest without being overstretched or overworked. Because you have your clinic hours, say 8 till 4 or whatever, 9 to 5, but then it's all the other stuff outside of that as well that you have to bear in mind.
So when you're working at those private clinics like Pure, for example, where you are today, so is that something where you've got your own client base, or is it something that they, like the physios, feed into you, or people book in directly?
So people will book in through the clinic. So for example, if you're with one of the private healthcare firms, then say Bupa is one of the busiest, most well-used ones. They'll say, the patient will say, I live or work in this area. I'd like to see a sport and exercise musculoskeletal doctor in this area. Who's on your list? Who's recommended? And so that will often be a pathway. Or it'll be they'll see a physio, and the physio will refer to you for an opinion or some advice. Although also when you get more of a name and a reputation as well, you might get people that want to come see you, or even they just Google, say, because I've done a bit of hockey and rugby, they might Google hockey doctor London, and if the tags are right on the search engines, it might come up as me, and they might go, oh, he's done a bit of hockey, and I've got hockey injuries, I'd like to see this person.
Yeah, that's always quite an interesting dynamic, because it seems to be a massively growing area. Like it seems to be so busy. Some of the clinics that we work with, which is on the physio side as well as consultant. But what's it been like since COVID's kind of reopened?
So it wasn't great at the beginning. So I started at Pure in December 2020, and I think we were just about to go into another lockdown. So it was pretty quiet. And then it kind of went up and down a bit. It varies with school holidays. Just before Christmas this year, everyone was worrying about the Omicron variant. So people just sort of shut up early for Christmas. And so it was quite quiet. But now, probably since end of February, March, it's really picking up again, and getting quite busy, and some days fully booked now, which is quite a change to before, and things are really picking up, which is quite exciting.
Yeah, no, it's almost like a forgotten thing. I went into a hospital yesterday in Leeds, and everyone had the masks on, and to me it was like, well, where's this come from? I've not seen it like this. Like, I get the tram into work, and you wouldn't really know COVID was even a thing, but then you go in there and it was like no handshakes, no anything.
Yeah, and some places are a bit more strict probably than they need to be. I think in clinical settings where you have close contact with patients, are still doing masks and PPE things for now. We'll see how it develops, but yeah, since Christmas really, since coming back in January, and most things are pretty much back to normal. But then we probably do more infection control measures that we should have done before. People are just a bit more diligent on, always wearing a mask, or you don't necessarily need a mask, but gloves, some sort of PPE, wiping down everything between patients, and that level of infection control has gone up a bit, which is probably not a bad thing, and that probably lasts a bit longer.
Yeah, exactly. And then in terms of what you work with English Institute of Sport, how did that come about?
So when I was doing my training, I was lucky enough to work for 6 months at the Institute of Sport and Exercise Health in London, and part of that role was covering the EIS in London, which was great. So I gained some experience there, and then just as any job came up as an advert, I applied, had an interview, and was lucky to get the role down in Bath.
So yeah, it's a great setup, isn't it? Bath, that seems to be, it's been the epicenter of sports medicine, or it's felt like that way, or certainly one of the main centres.
Yeah, so Rod Jakes, Paul Jackson, Stuart Miller, all down there, have been involved in the EIS and I think the Bath diploma, which lots of people do for sports medicine, and they linked up with Team Bath, the University of Bath as well, because we're on their campus in their sports centre basically. And yeah, it's pretty good setup there, pretty busy, number of people coming through, lots of athletes.
Yeah. And then in terms of just for your career then, do you have a vision of where a pathway of where you want to end up?
Yeah, there's a few jobs that are kind of on my bucket list, if you like, that I would really like to do. I always said
Probably the Arsenal head of medical at Arsenal.
Well, yeah, I mean, Gary's been there for over 10 years, and he's brilliant, and he's got Flo Newton with him as well, and they're both brilliant doctors, and I'm sure they won't want to leave anytime soon. And also, if I did go for that sort of role, I'd want to have a lot more experience under my belt, I think. And these football Premiership roles are quite all-encompassing as well, so it'd have to be, I think, at the right time in my life. The British and Irish Lions would be an amazing rugby doctor role as well. But there aren't many of these roles, and there's quite a few people that want to do them. So I think a nice balance of cases that are enjoyable and the work's fulfilling, but also working with good people as well. And some of the places I've worked have had absolutely brilliant people, physios, other doctors, strength and conditioning coaches, and on the management side, it's brilliant, and it makes work not feel like work.
And do you have your own particular philosophy on the way that you work? Like you mentioned that multidisciplinary approach there. Like, is there anything else?
Yeah, I mean, I'm quite strong on, ethics and morally and doing things the right way. I try and be collaborative as well. So with the people that I work with, we all be a good team, and I really enjoy discussing cases with other clinicians and hearing their perspective, and we can all learn from each other so much. And the English Institute of Sport is very collaborative like that. So we have really good, wide-ranging MDTs. But I just like to work with people who are good people. I think I can trust, rely on, get on well with, and like I said, often for it not to feel like work. Especially if you work with nice people, you want to socialise with them after work and you can go for a drink now, or go do mini golf for all fun events, or karaoke. You can do this stuff now. We've got more value for it, I think. So it's nice to work with people that you'd want to see outside of work.
Yeah, definitely. Yeah, well, everyone loves a bit of karaoke, so.
Well, there's one up the road here which I've had my eye on for a few months. So watch out, Chancery Lane Karaoke.
What's your voice like?
Well, I was in the choir at school, but I think I may have peaked. That was at junior school. I think I may have peaked then, although it came up on my Facebook thing. I think it was 15 years ago. I was in the musical at St George's at medical school. Thankfully, I don't think there are any tapes or evidence. At least I think I've burned most of the CDs or DVDs. They weren't VHS tapes. I'm not that old. But yeah, I reckon after a couple of shandies, I probably feel like I'm Michael Bublé or someone.
May well come down and try and experience that firsthand.
Yeah, you might need to come with a health warning.
And then in terms of like at the moment, I know you've still got a lot of your career to go, but were there any particular ones that stand out so far as being really memorable?
Yeah, I think so. Doing Matchday Doctor at Twickenham is pretty exciting. Having been there as a fan lots of times and seen all the games, you do have to pinch yourself sometimes about that. With Ealing a few years ago, we beat London Irish to win the British and Irish Cup, which is essentially the second tier rugby cup, and that was a pretty great day. Worked hard to that. Some of the hockey matches at the hockey centre in Lee Valley, which was the converted Olympic arena, has been pretty good. Looking after an Olympic team, the skeleton bobsleigh. They didn't have the results they were looking for, but working and looking after these guys is great. And seeing them compete and knowing their journey and knowing what they've had to overcome and having helped them a little bit is pretty rewarding. And some of the other athletes from Bath who competed at Tokyo and won medals as well. That was you have to pinch yourself sometimes and go, oh, that's so and so. I saw that, and now they're just won a gold medal. That's brilliant.
Yeah, I can imagine.
You have to reflect on things and enjoy that, I think.
Yeah, for sure. And then how did your work we've done some work with you at RSM. How did that come about, your involvement in that?
Yeah, so I've been a member of the Royal Society of Medicine in London since I was a medical student, because I always like conferences and going to things that I think are interesting. And you sometimes have to go out and find CPD events. Everything's not going to be handed on a plate to you. And I always found the RSM really good. I thought the quality of talks was good. The venue, the facilities were really good, and there was that networking as well. So I was a member for a while, and then applied to get on the committee of the Council for the Sport and Exercise Medicine section, and I've been doing that since 2015, I think, and then I was president of the section for a couple of years and helped organise conferences and things, which has been good fun. So it's good to put on these events, feel like you're providing some learning and knowledge. You're not really giving any talks myself, but facilitating that by finding speakers and people I think will be interesting. And then it's good for networking as well, developing a link of consultants, specialists that you then might work with in the future, which is definitely beneficial.
Yeah, we found them really good, and it's been quite nice. I think we enjoyed like the hybrid move, it seems to be, for that as well. So they've always been really well organised. So yeah, well done for that on our behalf as well.
Yeah, well, we hopefully now there'll be more in-person meetings, and they're definitely better because it's often the corridor chats, or you'll meet someone and you'll collaborate. And I always think the online things are a reasonable interim, and they're okay for some things, but for big meetings you can't beat the in-person ones. And I think we've got one in June or July on event and expedition medicine, which will be quite exciting, and there's other ones coming up. And I mean, obviously a disclaimer being on the RSM Council, but generally because they're a not-for-profit educational organisation, the fees and rates that they charge are much better compared to all conferences. And the facilities are great and the food's really good. You can have a really nice lunch, but then you might meet someone that you haven't seen for a while, or someone new, and you collaborate, make links. Yeah, it's enjoyable.
That's good. Have you interacted with Andrew Murray much? You mentioned expedition.
I know him. We've met probably once or twice. I know he does a lot of everything, golf and rugby, and his exercise medicine work in Scotland, and yeah, does some pretty great stuff.
He says incredible, some of his tales. Yeah, really is. Well, puts most people to shame, but yeah, certainly from my perspective, makes me feel very inadequate.
Yeah, I know what you mean. There's a few people like that, and they're super talented, super nice, high achievers. Yeah, there's a few people like that. But no, I haven't really done event. Well, I've done quite a bit of event medicine, but not the expedition side of things.
And so yeah, on that subject, so last question, who would you say has been significant influence on your career? You mentioned Rod a few times.
Yeah, so Rod, and he recently retired from the EIS and had a really nice send-off there. We had a dinner and a meeting, and that was great. And Paul Jackson at Bath has been very helpful. It's only really been the last year and a half. A few other guys, so Mike Rossiter, who was the GB England hockey doctor for a while, and rugby, he helped me get into hockey. And Matt Stride from Brentford, and now at Ice Kinetic Clinic. Addy, the former Saracens doctor, has been great. Courtney Kipps as well. There's Lorenzo Masci as well, has been a great help. There's a few, and then even I'm developing more links and finding more people who can help me on the path and provide some good support and guidance. There's a few good eggs out there. And then
definitely.
I try and, I think you talk about pass it on, so if someone's done it for you, try and then do it for other people. And I try and do that as well, people shadowing or getting involved or giving advice. And yeah, it's a nice thing to do, especially if you don't work in, say, the NHS sector, which a lot of us don't because there aren't the roles. It's nice to have the opportunity to be able to give back in other ways, whether it's through conferences or talks, lectures, CPD, or helping with career advice, and just trying to do something.
Yeah, no, definitely. This is the very last question. Do you think Arsenal will make the Champions League?
Yes, I'm going to say yes, but my opinion has changed on a weekly basis over the last few weeks. But beating Chelsea and Man United was pretty huge. Well, I think the Spurs game is going to be big. I don't know. Yeah, I'm going to have to watch that through fingers, I think. Just yeah, but we'll see. Hopefully.
Yeah. Well, very interesting, isn't it, with Tottenham, sort of a bit of a rise, but it's incredible like what a turnaround for Arsenal. To even think that you were going to be in this position is quite surprising.
Well, there's an amazing group of young players coming through, and yeah, I mean Bukayo Saka and just amazing. Smith Rowe. There's some pretty good guys there, and I hope they sort of seem like Arsenal boys coming through. So yeah, it's exciting again.
Yeah, no, definitely is. Definitely is. No, well, Dan, I really appreciate your time today. Thanks for fitting me into your busy clinic. And yeah, I hope to see you soon and listen to some of these Buble tunes.
Yeah, I might have to put a rain check on that, but yeah, my pleasure. And thanks for the support from Physiquip and the Alpinion ultrasounds and things. It's been great.
No problem. No, great to work with you. Thanks, Dan.
Cheers. Bye bye.